In a landmark case, an asylum seeker is taking the state government to court to fight his ongoing detention. Usually it's the Commonwealth which faces legal action by asylum seekers, but in this case the state government will appear in court tomorrow. Lawyers will argue that New South Wales Health breached its duty of care in the case of the mentally ill Sri Lankan asylum seeker. Here's state political reporter Eliza Blue with this exclusive story.
For the first time, the New South Wales government is facing legal action over the fate of an asylum seeker. This man, known as Mr P, arrived in Australia by boat 2 years ago. He was already suffering a mental illness and was moved to Villawood Detention Centre. His health deteriorated and he was sectioned as a mentally ill patient, and that meant responsibility for his care was transferred from the Commonwealth's Immigration Department to the New South Wales Health Department, and Mr P ended up in Liverpool Hospital. The state's mental health tribunal decided that Mr P should be treated by a psychiatrist outside the hospital, but instead he was sent back to Villawood because he's deemed a security risk and can't be released from detention.
I'm incredibly concerned that my client has been abandoned by the mental health system in New South Wales, as well as the health providers in detention and the federal government. Everyone has been extremely dismissive about our calls for urgent, assertive health care. He's just not getting any decent mental health care in detention.
George Newhouse says Mr P has fallen through the cracks and he's taking the state and federal governments to court tomorrow to get better treatment. Greens MP John Kay says more should have been done.
They could have said no to the community treatment order. They could have insisted instead that he stay within a mental health institution and that the New South Wales government negotiate a better outcome with the federal government. They didn't do that. They took the easy option, and as a result of which Mr P is now a very ill man.
The Health Department says that due to patient confidentiality and because the matter is before the courts, it's inappropriate to comment. Mr P's lawyers want him moved to a secure mental health facility for long-term rehabilitation.